Hello, everybody. Welcome back. Sorry if it's been a long time since I last recorded, because I'm just busy with stuff. And today we're going to be switching gears back to medicine, and it is heart failure overview part 3. This is going to be our last part on the heart failure series. So, yeah, and we're going to mainly talk about treatment and, yeah, all of that with heart failure. So stay tuned. But before we do that, I do want to say something about last video. So basically, I think there was something unclear. Well, last video we looked at the ejection fraction of heart failure. So we know that in order to differentiate diastolic and systolic heart failure, we look at the ejection fraction if it's preserved or not. But some people may be wondering, well, how do you even measure like end diastolic or like end systolic volume? Well, how you measure that is through echocardiography. Basically, again, it's sending ultrasound like sound waves through the heart, and once the sound waves bounce back, they are basically like casted onto like a computer screen. So basically, it shows all the ventricles and the blood flow through the heart. So that's usually how they calculate the end diastolic and end systolic volumes and all of that. But without further ado, let's get into the treatment of heart failure. So, yeah, treatment of heart failure. So, there are a lot of treatment options out there, ranging from lifestyle changes to more serious like medications or sometimes even surgery. And then finally to like end stage heart failure, then you have to have like a heart transplant or like a ventricular assist device. We'll talk about those later, but let's start off with the easier ones, lifestyle changes. So, what are some lifestyle changes that, well, can help with heart failure? Usually, lifestyle changes can reduce stress and strengthen the heart. In this case, so in some cases, so to prevent heart failure from worsening. So basically, some lifestyle changes include a low salt diet. That's because salt basically makes the body retain onto water. And you don't want your body to retain onto water because that increases blood volume, which increases blood pressure. And when there's high blood pressure, the heart needs to work harder in order to pump that blood through your body. Then you also have frequent exercise. That is obviously to strengthen your heart. There's really no doubt about that. But then you also have diet low in cholesterol and saturated fats slash trans fats. So these can like build up in the body, and these fatty deposits can stick to your artery walls and basically cause like blockages in your arteries. You don't want that. So narrow intake on these. And then you also have fluid restriction. This is basically just that kind of makes sense. Again, you don't want your body to have too much blood volume, or basically too much water is reabsorbed, because then you again have increased blood volume and increased blood pressure. And you also reduce intake on alcohol, which is also pretty reasonable because alcohol can damage the heart, and it also counts as a fluid, to be technical. And finally, one of the most important facts is to get adequate sleep and rest, because your heart really, in this case, needs some rest in order to make sure it heals properly. So this is mainly for those who have like stage 1 heart failure. So you don't really have that much going on, and maybe just symptoms arise when you like do some exercise. But then, speaking of which, for stage 2 or 3 patients, you may have to use some medications. Medications indirectly benefit your heart by reducing the workload on the heart. So basically, in stage 2 or stage 3 patients, like the patients usually their heart cannot pump enough blood such that the body really is like screaming, hey, there's not enough blood for us. Can we get some more? And then, as we have talked about, then the nervous system starts kicking in. Stress hormones like epinephrine and norepinephrine, which is basically fancy names for adrenaline. Anyway, those like I guess those neurotransmitters travel through your autonomic nervous system, which is basically a nervous system that well helps control blood pressure and digestion and just overall your flight and fight response. But these medications can either block your stress hormones from reaching your heart. Remember, the stress hormones are a compensatory mechanism as your heart is unable to pump enough blood. So the body thinks it has to work harder in order to get that same amount of blood. But over time, when you overwork your heart, just how you overwork your body, your heart can get even more damaged and you don't want that. So medications aim to reduce workload on the heart mainly by reducing blood pressure. So first of all, you have ACE inhibitors in ARBs. These classes of drugs act on the RAAS or the renin angiotensin aldosterone system. Basically, that's like a whole hormonal system used to control blood pressure. But these are like some of the drugs that help prohibit this response from happening. So basically, these prevent high blood pressure and lower your blood pressure in general, like just in simple terms. So that again helps the heart because it doesn't have to pump that hard in order to pump the blood through your body. And then you also have beta blockers. These again act on your stress hormones and help block them off so that your heart doesn't receive those like complaints about your body saying you have to work harder. Well, your heart is already damaged. So, yeah, beta blockers just do that. And finally, diuretics. These are a special class of drugs that help the kidneys filter water. So basically, that again helps with fluid reduction and then lowering blood pressure. And finally, for stage 3 and above patients, you may have to use surgery or surgical interventions. There are basically surgical interventions. Usually, they address the underlying cause and treat it. So in this case, a lot of people can probably have heart failure from like coronary artery disease. So because that's the leading cause. So they may be like, wait, I need to get my coronary arteries fixed. So you can have either a cabbage procedure or a coronary artery bypass graft, where basically arteries from other parts of your body are inserted over here on this diagram so that it's beyond the blockage site and so that when the heart pumps blood, the blood can go from here and then over here to the rest of the heart muscle. And yeah, that's basically the coronary artery bypass graft. You sew a graft between these two arteries. The graft is literally the artery. So these arteries, like these graft arteries that help bypass the blood flow, can be from your chest or your legs. You can also visualize this as creating freeways. Like, remember how we explained heart failure using the erythrocyte analogy? You can picture this as well, the erythrocyte buses are moving to deliver oxygen to your heart. Well, it's blocked so that you have to create like freeways to like lessen up the traffic jam and for them to like get there in time to deliver the oxygen. And then we also have percutaneous coronary intervention. It's basically another way of opening up the coronary arteries in case of coronary artery disease. So coronary angioplasty, which is another name for that, basically what you do is that this is also a more minimally invasive procedure, meaning that you don't have to literally open up the heart to literally do this procedure. You only have to insert a catheter into your heart. So the catheter is like a small soft tube. And then when you insert it into your heart, there's a balloon on the catheter that inflates the artery like from the site of the blockage. And then there's also something called a stent that's on the balloon as well. This helps hold the artery open. So this is basically a wire mesh. So yeah, it should hold the artery open, but there are some complications like them listed over here. Okay, so those are for coronary arteries blockages. But then you also have heart valve surgery, which is also another common option, but this time for patients who actually have damaged heart valves. So in this case, well, an artificial valve can be implanted, as shown here, can be implanted through again a catheter well connected to the stent to hold again the old valve open, and a new valve would be replaced into like what valve you're trying to replace. So yeah, that's heart valve replacement surgery. It helps to soothe the blood flow throughout the heart. So basically it flows more smoothly instead of your heart having to pump against turbulent flow. This can be done using the traditional method or the minimally invasive method. And then you have for those with stage 4 heart failure, or like literally end stage heart failure, where your heart your heart like literally can't pump blood to an extent that just even resting can feel pretty challenging. Then you have your LVADs, or just ventricular assist devices in general. And there's also heart transplants. So basically, LVADs, what they do is that for those with end stage systolic heart failure, you basically have an artificial pump. So basically, the blood from your left ventricle, as it fills with blood during diastole, all the blood is transferred into this pump just below the heart. And this pump is also connected to a control unit and a battery so that it gives it power, to pump the blood. And after pumping the blood will again return to your aorta. Just so it would return to your aorta, your aortic trunk, if you will. So then the blood still flows freely throughout your body. Although LVADs can still be a little bit challenging to manage as you have to basically wear this thing all day. But yeah, they're usually sometimes temporarily used, like just before like a heart transplant, or sometimes they can be destination therapy where it's permanent or long-term treatment. But anyway, LVADs can also sometimes even reverse heart failure, which is another plus. But then you have a heart transplant, which probably a lot of you already heard of. So yeah, there's really not that much explaining done here. You just basically replace your old damaged heart with a donor heart. The only thing the only thing that really needs explaining is that, well, when you have a new heart, sometimes the heart, obviously, everybody is unique, okay? So even your cells are unique to the level where that they will have different markers on them, you could say. And these markers or antigens are different from your body recognizes if you have a foreign donor's heart. So basically, your immune system recognizes your heart as a foreign object, your new donor heart as a foreign object, and attacks it. And you obviously don't want that, or else the heart transplant would just be useless. So you actually have to take these anti-rejection drugs that slow down the immune system, but also make you more suscept oh my god, just make you more vulnerable to like common diseases like the cold or flu. So yeah, so that's something to consider when you're doing a heart transplant. And then you also have some risk factors for heart failure. So yeah, we're getting more over to the prevention and risk factors. First of all, having a family history of hypertension, diabetes, or heart failure, or coronary artery disease is a risk factor. And then you also have smoking. Yeah, that's like the major risk factor. And then obesity. And then you have diabetes. And then you have drinking too much alcohol, which, yeah, can be a risk factor for heart failure. And then some prevention uh, measurements you can take for heart failure is basically exercising daily and eating like a heart healthy diet. So basically, leafy greens, and then you also eat some like protein. Make sure it's a balanced diet as well, and don't eat that much processed foods because who even knows what's in them. And then also don't smoke and don't drink excessive alcohol, which is pretty reasonable. And finally, if you are pretty stressed out, try to manage your stress either through meditation or yeah, so try to manage your stress as that can also have a negative effect by increasing blood pressure on the heart. And with that, we are finished with our today's episode on heart failure. I hope you guys liked it. Again, I'm not a medical professional, so don't take this seriously. But anyway, thank you guys all for watching and see you guys next